Hello everyone, my name is Riley Hopefelker, and today for my digital researching project I elected to do patellar tendinopathy in basketball participants. Patellar tendinopathy is defined as an injury to the tendon connecting a human's kneecap to the shin bone. This diagnosis is composed of microscopic tears within the tendon caused from repetitive overloaded running and jumping. Once tears are multiplied and abundant, the specific tendon becomes inflamed and weakened, resulting in tendinopathy and an abundant amount of pain. So seen on your left here is a diagram of the entire knee within the human body. Seen here is the quadriceps and then all the way down to your tibia. So from your quadriceps to your tibia runs your patella tendon with your patella or kneecap engraved within this tendon. And the red area here indicates where this pain will be found if you have patellar tendinopathy. I included some MRI scans of various degrees of patellar tendinopathy. Seen on the left here, this big line of darkness is your patellar tendon. This particular MRI shows a healthy patellar tendon, and then as we move from left to right here, this image shows a much more inflamed patellar tendon. Obviously, you can see how much wider the thickness is of patellar tendon and how these fibers are inflamed. And then all the way on the right here, this shows a ruptured patellar tendon with a whole bunch of fluid encased in this area, as seen here with this white fluid. Patellar tendinopathy signs and symptoms. Most of your symptoms will be internal. You can't really see too many external signs. So these internal symptoms are localized pain over the inferior pole of the patella tendon. This is just over the front side of your kneecap. Load-related pain, which worsens with increased knee extension and rapid energy release movements. Pain in the midst of prolonged sitting and squatting or climbing stairs in very severe cases. And then a 24-hour marker, which I'll come back to in a little bit. And then external signs are inflammation of patella tendon as well as swelling. These two go hand in hand with one another. And then tenderness to the touch of the inferior knee right over that kneecap region. Treatment solutions and care for patellar tendinopathy have been widely complex. They can take various forms depending on the severity of the patient's condition, ranging from less extreme treatments involving therapeutic exercises to extreme solutions including surgical procedures. Directed care towards this condition is dependent on the health practitioner's consultation and preferred plan. So seen over here in this list, in very mild cases of patellar tendinopathy, medication will treat the given pain, but in much more severe cases, surgical operation is needed. Alright, so I elected to include some scientific data analysis and review within my project. So I found this study done in 2020 by Quasi-Muadam, which conducted an overview of scientific literature regarding patellar tendinopathy, including its risk factors and effectiveness of various treatments. So what this author defined patellar tendinopathy as is a musculoskeletal disorder seen in sports involving progressive and loaded running and jumping. It's seen in 45% of elite basketball players throughout their careers. Causes range from hamstring and quadricep tightness to leg length discrepancies, and then treatments can range from just injection therapies to surgery, and no single method of treatment has been proven to be effective, absolute effective in each and every case any doctor has ever seen. So a significant amount of studies have demonstrated that eccentric exercises aid in rehabilitation. These eccentric exercises have been proven to repair collagen fibers within the patella tendon, as well as a majority of other tendons in and around the knee. And as well as these eccentric exercises, open kinetic chain exercises has also been included to show that these exercises are beneficial to the treatment of patellar tendinopathy. Some literature also shows that heavy, slow, isotonic exercises to be effective in treating patellar tendinopathy, but these exercises do not promote that collagen repair in the fibers of the patella tendon that eccentric exercises do. So seen here, this is the injection treatments, so made up of plasma, white blood cells, and platelets and red blood cells. These are centrifuged in a centrifuge machine and are given to treat patellar tendinopathy conditions. And then this is the eccentric exercise movements that are included in these studies: a steady decline with a one-legged unilateral squat. And then this is also another example of eccentric exercises and isotonic holds. In another study I found conducted by Breda in 2021, this is an academic research study investigating the differences in progressive tendon loading exercises and eccentric exercise therapy for optimal recovery and treatment. So these put the treatments that I found in the recent article that I just showed you comparison, so side by side, and I was interested to see which one resulted in the best treatment results. So this test involved 18 to 35-year-olds with patellar tendinopathy pain. Subjects were randomly divided between progressive tendon loading exercises and pain-provoking eccentric exercise therapy groups. They're instructed to use resistance band flexibility and strengthening work in pair with these given exercises. They were graded on a VISA-P test assessment. The VISA-P stands for Validated and Injury-Specific Assessment. So what this test is a score from 0 to 100, with 0 being the most extraordinary pain anybody's ever felt and 100 being absolutely free of pain. So as seen here in this diagram to the left of your screen, the PLTE group showed much more effective results and was pain-free in a more rapid pace after 24 weeks than the EET group of eccentric exercises. The PTLE group also showed that they had a higher rate of return to sports once therapeutic exercises were done in this manner. They were also scored on a visual analog scale. I did not find a diagram for that, but the visual analog scale is your standard 0 to 10, pain rating with 10 being the highest pain you've ever felt and 0 being no pain at all. And the recorded statistics showed that the mean score for the PLTE group was 2, and the eccentric exercise therapy group was a mean score of 4. In yet another scientific literature that I discovered was done by Kongsgaard in 2009. It was a pivotal study in reviewing multiple treatment options for the betterment of athletes across the world. Using 52 recreational male athletes, precise results were given and analyzed. This research put previously discussed methods of treatment in comparison with one another. So these athletes ranged in the age of 18 to 50 years old, and they were also randomly divided into 3 different groups, similar to the previous study that I found. So these 3 groups were the CORT group, which is ultrasound-guided injections for anti-inflammatory treatment, and then the ECC group, which is eccentric exercise program. This was done 3 sets of 15 on eccentric exercises twice daily. And then the HSR was a weightlifting program that was recommended for 4 sets of 15 reps each and every day. So the pictures down here indicate which group did what. This was the eccentric exercise group with that incline. Eccentric exercises that they did is shown here, and then the weightlifting program is shown here with some barbell back squat, a leg press, and a hack squat. So back to my results here. These results indicated that vast improvements were made using all 3 methods of treatment with linear patterns seen on each of the 3 on the screen. Although this linear pattern did show some differences between groups, the VISA-P improvement was shown higher in the HSR group and the eccentric group. Obviously seen here in the slopes, these lines, this is a much steeper slope than what the injection showed here. And the HSR group maintained the best, seen here by this line, whereas the injection group had a very rapid decline in treatment after a 6-month follow-up. And then the visual analog scale also indicated some interesting results. They showed improvement in all three of the groups rather, but the injections, once again, after a 6-month follow-up, would show a decline or an increase in pain after 6 months rather, whereas the eccentric and HSR groups maintain themselves pretty well. So patellar tendinopathy is an ongoing study that doesn't have too many answers right now. So the future of patellar tendinopathy studies and treatment effectiveness remains to be seen. Existing as an incredibly prevalent condition in basketball athletes, medical experts remain uncertain regarding the longevity of treatments and satisfactory of the given athlete. An abundance of studies are opportunistic in their accessibility to discovering treatment plans and options for all athletes. With the growing evolution of technology and knowledge, patellar tendinopathy is likely to be treatable and even more so preventable within the human body within the coming years. As students advance in their educational and medical careers, I hope that all of us are part of many research activities that lead to a healthier life for not only athletes, but to all humans across the globe. And these are my references. Thank you.